As India gets ready for its latest weapon in the fight against COVID, the vaccine rollout, an earlier much-hyped weapon has slipped from public focus. This is the Aarogya Setu app. Remember it? It's the government's contact tracing app launched in April last year as the pandemic had brought the country to a standstill. The app was pitched as a major tool in the government's arsenal against COVID. Despite skepticism over its effectiveness, as well as concerns over privacy, the government pushed hard to get millions of Indians to sign up for the app. Controversially, the government even made the app mandatory in a number of different scenarios, including making it mandatory for all government officials to download, as well as for entering airports, crossing state boundaries, and even entering workplaces. At last count, close to 17 crore people are said to have downloaded the app. Now, the government claims that the data collected by the app, including the user's COVID positive status as well as their movements and their contacts, is meant to help with contact tracing and identifying COVID hotspots. But questions remain unanswered over exactly how effective the app has been in containing the virus. On different occasions, the government has made somewhat vague and sweeping claims of what the app has been able to achieve. Aarogya Setu has successfully predicted a large number of potential hotspots, said the PIB Press Information Bureau in a January 2021 release. Months before that, more than 3,000 hotspots have been predicted in almost 3 to 17 days ahead of time. The app has alerted over 1,40,000 people of the potential risk of infection, said Amitabh Kant, CEO of Niti Aayog, on 2 separate occasions in the middle of last year. It's helped alert authorities about more than 650 hotspots across the country. This was again Amitabh Kant in May of 2020. But when my colleague reached out to officials in New Delhi and the states to understand whether and how the help fight the battle against COVID-19, most of these officials said the app played little to no role in contact tracing or identifying hotspots. Meher Pandey now joins me on the show. Meher, great to have you. Now, Meher, just start off with telling us what you found out when you met central government officials who are very much in the control room of the Aarogya Setu about what they claimed the app actually achieved.
Yes, Vasu, I spoke to multiple health and disease surveillance officials, and most were vague and in how exactly the app helped them contain the virus, and none could share data on how exactly how much the app could limit the spread of the virus.
Right.
So first we have Dr. HIMANSHU CHAUHAN, who is the Joint Director of the Integrated Disease Surveillance Program, which is a body that maintains and shares disease surveillance data. He said that Aarogya Setu does not identify hotspots at all. It is actually another software that does this, which is in effect independent of the Aarogya Setu app. We will get into this a little bit later, but he also said that he can't comment on why the Niti Aayog chief claimed that the app helped identify emerging hotspots. He also said that the Aarogya Setu was always meant to supplement manual contact tracing and not replace it. He said that Aarogya Setu allowed health officials to diagnose and isolate cases early, and that a central level team sends data from the app to states every morning. Data on users testing positive and their contacts is shared every morning, and the peak utility of the app was in May and August before what he called bad press about privacy regarding the app.
Okay, interesting. Now, this was, of course, the gentleman at the central level, but you also spoke to a number of state government health officials who are actually on the ground, doing contact tracing and fighting the app. Run us through what some of them told you.
Yes. First, we have a Delhi health official who claims that the app, along the line of many, they claimed that the app was helpful, but she was vague about how exactly. They said that the app works only if the user gives correct phone numbers and if the user does not have multiple phone numbers.
Okay.
They said that the Bluetooth has to be on and they need access to internet, and which is limited as well. They said that compliance level to the app were low, and they had seen a cluster with over 80 people, but only one Aarogya Setu app user.
Right.
And because of all of this, they've had to massively scale up manual contact tracing.
Okay.
Next, we have an Uttar Pradesh health official who said that they don't need Aarogya Setu's Bluetooth and location data at all. They collect their own data manually as well. So they get Aarogya Setu, but they have a lot of people working on the ground.
Right.
Yeah. So they have 70,000 surveillance team of 3 people each.
Okay.
Next, we have Dr. P. Sampath, who is a Tamil Nadu state surveillance officer.
Okay.
He said that only educated people use the app, which is upper middle class people who are urban and use smartphones and apps.
Okay.
And that they don't need the app's contact tracing or location data, and they do their own manual contact tracing. And lastly, we have Dr. Nitin Kulkarni, who is the Jharkhand Health Secretary, who said along similar lines that the app may not have helped to a large extent, but was still very helpful.
Okay.
Very vague. He said that the app depends on Bluetooth being on, which is difficult, and that still the app was helpful because they got calls from people who were in proximity to COVID cases, so they called up health officials themselves and volunteered to be tested. They cannot share breakup of contact tracing done through the app versus manual contact tracing.
Okay, so all fairly sort of vague and not very convincing responses. Now, also, Meher, you found as part of your investigation, you came across how another software tool is also being used for surveillance, which you referred to earlier. This was meant to be part of the Aarogya Setu platform and is the one being relied upon to identify COVID hotspots, bypassing Aarogya Setu. This is a tool called ITTAR, which is an acronym for IT-enabled integrated hotspot analysis system, which uses cell phone data for the surveillance of COVID-19 positive cases. Now, in theory, this tool was supposed to use data from Aarogya Setu as well as from ICMR, but I think some officials you spoke to said that now this tool is actually being even used independent of Aarogya Setu, Meher.
Yes, Vasu. I spoke to an official in the Ahmedabad Municipal Corporation, which was the first place to use the ITTAR tool to map hotspots. They said that they only use self-assessment data from the Aarogya Setu app, and that all contact tracing was done by human contact tracers, which is people who sit in their offices and go on ground. They use ITTAR's data to identify potential hotspots, and Aarogya Setu data isn't exactly helpful.
Okay.
They clarified that the ITTAR tool uses cell phone tower pings to identify hotspots, which find location of positive cases. This is done through authenticated mobile phone numbers provided to ICMR when people get tested. So the need for the Aarogya Setu app is bypassed almost entirely.
Right.
Then lastly, we have a Maharashtra health official who was again unclear who exemplified this lack of clarity between the difference between Aarogya Setu and ITTAR. And they said that Aarogya Setu helps us focus our efforts on emergent clusters and hotspots.
Right.
But ITTAR flags clusters and hotspots early and helps us focus our manpower.
Okay. All right. So, there you have it. Thanks very much indeed, Meher, for joining us. Now, basically, as we just heard there from Meher, that she spoke to a range of officials, some who were willing to come on record, others who didn't. But the general sense from them was that Aarogya Setu may have been one of the instruments in fighting COVID, but when it came to the hard business of contact tracing, of trying to identify hotspots, it was largely their own efforts and their own surveillance, which still, as I said, raises these questions over what this much hyped app has set out to achieve in the fight against the coronavirus.